Welcome to the deep dive. Today we're doing a really quick but important look into early pregnancy health. And we're using information from sources like Blood Test UK to guide us. Our whole mission here is just to understand why, a specialized blood test can give you so much more information, especially for those of you listening in the UK, maybe somewhere like Stirling.
Right. And it's fascinating because it's not just about speed, is it? These tests, they're looking at a hormone called HCG. That's human chorionic gonadotropin. And what's really key is how its levels are increasing. That's the real sign of a healthy early pregnancy.
Okay, let's dig into that, because I think most people just think of, a simple urine test from the chemist. But the sources, like Blood Test UK, they're saying a blood test is just, it's way more accurate.
So much more accurate. And that's because it's quantitative. It gives you an actual number.
A number, not just a line on a stick.
Exactly. So a urine test tells you if you're pregnant. This can tell you how well it's progressing. And that data is what allows doctors in places like Stirling to spot potential issues far, far sooner.
So you're getting ahead of problems before they even become big problems.
That's the whole point of early prenatal care. I mean, if the HCG isn't doubling correctly in those first few weeks, that's a red flag.
And that early warning leads directly to the main benefit, which is better health outcomes for both mother and baby.
Absolutely.
So what sort of things are we actually looking for? What specific conditions can this help identify early on?
Well, it's all part of the standard NHS approach, really. These screenings are a key piece of the puzzle. They help calculate the risk for conditions like Down syndrome, for example. And they also monitor the mother's health, checking for things like anemia, which is low iron, or early signs of gestational diabetes.
And getting that information early gives you time, doesn't it? Time to prepare, to consult with specialists, to manage things properly.
That time is invaluable.
So for someone listening right now, maybe in Stirling, thinking, okay, I need to do this, what are the practical steps? What does the info from Blood Test UK say about, the practical side of things?
It's actually very straightforward. The main thing is to book your appointment in advance. It just saves you sitting around in a waiting room.
And do you need to fast or anything like that?
Usually not for this specific test, but it's always a good idea to just double check when you book.
Okay, so you go in, a trained healthcare worker takes a small blood sample, and then what happens?
That little sample gets sent off to an accredited UK lab. And they're the ones who check those HCG levels and the other markers we talked about.
Right, and when you get those results back, what do the numbers actually mean? What is a good number?
Well, there's no single good number. It's all assessed using NHS guidelines, and it's about the trend. So a normal HCG level that's doubling nicely suggests everything is progressing as it should.
Okay, makes sense.
If you see a low HCG result, it could just mean the pregnancy is much earlier than you first thought. Or it might flag something that needs a bit more monitoring.
And a high number, is that a problem?
Not necessarily a problem. A high HCG level can be the first clue that you might be having multiples, like twins. Or, could point to other complications the doctor will want to look into. So really, this accurate early knowledge it's the best tool you can have. It turns waiting and worrying into active management.
Absolutely. So it seems like timing is everything here. Test too early and you might get a false negative because those hormones just haven't built up yet. Which leaves me with a final thought for you to chew on. Considering how quickly those hormone levels change in the first few weeks, how critical is it that we really understand the perfect schedule for these tests? Not just one test, but the frequency of monitoring throughout that entire first trimester.